Welcome to Cardiac CT Training Associates, systematic review of cardiac CTA, complete analysis from image processing to reporting. This is the third and final module regarding report generation and clinical recommendations. The Society of Cardiovascular Computed Tomography has written an authoritative paper on guidelines for interpretation and reporting of cardiac CTA, which will be reviewed as follows. Initial A interpretation, the non-contrast scan, including coronary calcium scan, is not necessarily required, but is highly recommended by cardiac CT training associates to be done in all patients who have no known prior history of cardiac disease. When performing this analysis should include evaluation of the Agatston coronary calcium score for each vessel, the score in total, the percentile rank, and a notation of the presence of calcification and other extracoronary structures such as the heart, the valves, the pericardium, and the aorta using qualitative assessments such as mild, moderate, and severe. Coronary contrast examination, variety of examples of the terminology could include calcified plaque, non-calcified plaque. It's important to not report the presence of soft or lipid-rich plaque because these are misnomers. Mixed plaque, which we often also call complex. This includes both calcified and non-calcified plaque components. Other terminologies such as ulceration, dissection, fissuring, osteal, branch, long, positive remodeling, and aneurysmal are all considered acceptable terminologies. There is a recommended qualitative stenosis system of grading suggested by the SCCT, which includes 5 grades. Normal, which means the absence of plaque or luminal stenoses. Minimal plaque with negligible impact on the lumen. Mild plaque, which is plaque with no clear flow-limiting stenoses. Moderate plaque with possible flow-limiting stenoses. Severe plaque, which is probably or likely flow-limiting. And finally, occluded. Other types of recommendation for qualitative stenosis grading include other characteristics of 5 grading systems. Normal, minimal plaque with a plaque stenosis less than 25%, mild 25 to 49% stenosis, moderate 50 to 69%, severe 70 to 99%, and occluded. Please note, though, that quantitative assessment using any technology of coronary stenoses by CCTA has a 95% confidence limit of plus or minus 25% at best. If you review the latest recommendations for the criteria of coronary revascularization published by the American College of Cardiology, which includes the potential for performing PT angiography or stent placement, it's important to appreciate that the decision is that any stenosis should be significant if it's greater than a 70% luminal diameter in the body of the coronary arteries, except for the left main, which is considered significant at 50% luminal diameter narrowing. Thus, we highly recommend an optional quantitative stenosis grading that includes 4 separate gradings. Normal, the absence of plaque or luminal narrowing. Mild, plaque with a less than 39% stenosis. Moderate, a plaque with 40 to 69% stenosis. Severe, plaque with 70 to 99% stenosis. And finally, an occluded artery. Non-coronary cardiac structures also should be reviewed, including the pericardium, cardiac chambers, inner atrial and interventricular septum, the valves, the coronary veins, the pulmonary arteries, and the thoracic aorta. Extracardiac structures and comments should be made if they're included in the cardiac field of view and may include the mediastinum, hilum, trachea, and other surfaces. And also, review is felt to be extremely important for recognition of primary and secondary comorbid pathology, and these findings may also lead to alternative non-cardiac diagnoses. The Committee for the Society of Cardiovascular Computed Tomography recommended review and, if abnormal, additional reconstructions and/or expert consultation on these particular extracardiac structures. Overview should include in the report indications for the procedure, emphasizing the appropriateness of the examination, a brief clinical summary of the patient's history, a review of the procedure and patient preparation, including image acquisition and image reconstruction, the results, including technical quality of the examination and clinical scan findings, including details and impression or summary and optional clinical recommendations. It is also recommended that selected labeled images of the findings be also placed within the report. This particular individual, AR, that we are examining, this is the demonstration that you would put in the report with respect to the patient name, birth date, scan date, and other important characteristics, including the imaging modality employed. This is a review of the overall impression in this particular patient. We reviewed the overall coronary and vascular structure in Module 1 and Module 2. This patient had normal left ventricular size and global systolic function, and a summary is shown here in the upper panel. Recommendations are optional, but in this particular patient there was no evidence of obstructive disease. No further cardiac testing is suggested. However, an aggressive risk factor intervention program should be initiated given the fact that this patient has a calcium score of 75, placing the value at the 99th percentile for age. Indications are given in the third panel, demonstrating this patient's individual history and the fact that the examiner has reviewed the clinical record and agrees with the performance of this examination. Finally, a brief note on the procedure, including the use of oral metoprolol for slowing the heart rate down and the use of sublingual nitroglycerin. A brief summary of the procedure as to whether it was done prospectively or retrospectively with respect to the gating technology, how much contrast was given, and what types of images were reviewed. In the detailed section, one can report again using the 18-segment Society of Cardiovascular Computed Tomography model, looking at the left main, left anterior descending, left circumflex, right coronary artery, in addition commenting on left ventricular size and function, reporting on the extracoronary structures such as the left atrium, right ventricle, and the pericardium. Finally, the coronary calcium score should be prominently displayed. This completes the systematic review of cardiac CTA and complete analysis from image processing to reporting.